عددنا لحد هسه 14 دقيقة، ننتظر ونبدأ المحاضرة إن شاء الله. Okay, we'll start our lecture today, which is about the skin manifestations of systemic diseases. طبعا our skin has three major relationships between the skin and the body. There is three-dimensional relationship. First of all, there is an effect of skin on the body. Effect, example of skin disease on the body, on internal system. And we have disease affecting both skin and body. And we have a skin as a mirror of internal disease. Today we'll talk about this topic, skin as a mirror of internal diseases. The most common systemic disease we'll talk about is xanthoma and hyperlipidemia, diabetes, endocrine disease, some examples of endocrine disease, examples about nutritional disease, liver diseases, renal diseases, GIT, and last we know what about bioderma gangrenosa and Behçet disease. First of all, we'll talk about xanthoma and hyperlipidemia. What is xanthoma? It is, by definition, deposition of lipid in the skin, which may be due to hyperlipidemia. May be due. We have two types. Primary, which is genetically determined, and secondary, which is related to other problems, other medical problems such as liver diseases, pancreatitis, hypothyroidism, chronic renal failure, diabetes. Okay. Usually hyperlipidemia is classified according to the type of lipoprotein profile. This is determined specifically by a paper chromatography. They divide it into type 1, type 2, type 3, 4, and 5. Okay, which we are most interested is type 3 and type 4, which is commonly there is association between skin and systemic internal disease, systemic diseases in type 3 and 4. Xanthelisma. Now we talk about types of xanthoma. Usually we have clinically 5 types, which is most common type is xanthelisma. Xanthelisma is the commonest type seen in middle-aged people. Usually the patient presents with bilateral, symmetrical, soft velvety papules and plaques that are arranged around the inner canthus, in the lower and upper inner canthus. It may represent a localized skin problem, which is a cosmetically problem, or may reflect a systemic problem, a systemic hyperlipidemia. Usually, the blood level in this disease is normal lipid profile. They don't have abnormal hyperlipidemia. Okay. Usually, just 20% of cases may be related to hyperlipidemia. Type 2 is tuberous xanthoma. Tuberous xanthoma present as firm papules or nodules on the pressure area, seen on pressure area. like extensor aspect of the limbs, especially the knee and elbow. يا جماعة الصوت واضح؟ تسمعون الصوت واضح؟
واضح دكتورة.
تمام. إذا ما تسمعون صوت أو شيء يعني تبلغون قولوا.
تمام.
Okay. Second type is tuberous xanthoma. Third type, tendinous, origin from the tendons. Okay. Also present as multiple papules or nodules. Okay, attached at tendon site of the hand and feet, for example. Eruptive xanthoma. Eruptive, they are small pinhead. Okay. More accumulation, there's large number. When we say eruptive means all of a sudden presence of large number, groups of papules. Okay, may occur at any site, but most common sites are the buttocks, shoulders, and extensor surface of the extremities. Usually this type, eruptive xanthoma, is associated with diabetes, pancreatitis, seen. Okay, it is associated with increased triglyceride level. the increase triglyceride level. عكس الزانثوما قلنا الزانثيلزما العفو قلنا انه most cases have a normal lipid profile except in only 20% of cases. Number 5 or the fifth case, plain xanthoma. Plain at a clinical presentation, it looks like a plain or a flat-topped plaques or macules or slightly palpable plaques involving any site, okay, of the body. Example, the palm. Yellowish plaques or macules, okay, seen on the body. Generalized plain xanthoma. These types cover larger area, example, the face, the neck, the trunk, and all over the palm also can be involved. نسميه generalized plain xanthoma. يعني إذا كان localized to one area سميناها plain xanthoma. If all over the body involved سميناها generalized plain xanthoma. Treatment of xanthoma. For xanthelism, surgical excision for cosmetics issues يعني. Destruction by cautery, TCA, carbon dioxide laser, okay, or even surgical excision. For other types of xanthoma, which are associated with hyperlipidemia, usually we need dietary fat and carbohydrate restriction. Okay, and using also lipid-lowering agents, treatment of the underlying condition if possible. Sometimes also we can do laser excision, but the recurrence rate is usually high. We finished from xanthoma. Now we have another topic, which is skin manifestation associated with diabetes. Diabetes mellitus. Usually, approximately 30% of patients with diabetes present with cutaneous manifestation. It means it's something common to see skin manifestations. The most common skin manifestation associated with diabetes is diabetic dermopathy, which is known as shin spot. Okay, present approximately in 40% of patients with diabetes, most commonly seen in male, more than 50 years old. Diabetic dermopathy usually is asymptomatic. There's no itching, no pain, no tenderness, but present as pigmented atrophic scarring lesion. Atrophic وslightly ممكن pigmented brown color ممكن dark بس اكو atrophy بالskin. Atrophic scarring lesion. Usually they are multiple and usually are bilateral. Seen on the shin, forearms, thighs, and even over bony prominence. These are diabetic dermopathy. You can notice multiple macules or patches, small patches with atrophy in the skin. Skin color or slightly hyperpigmented or darkly hyperpigmented, okay, brown with atrophy in the center. Okay, diabetic dermopathy. With number 2, we have bullous diabeticorum or diabetic bully, which occur usually spontaneously, non-traumatic bully, spontaneously. Okay, most common seen on the feet and hands, usually non-inflammatory, heals within a few weeks without any scarring. Number 3, we have pruritus, generalized itching, pruritus, generalized pruritus, usually due to dry skin. جماعة الدايابيتس عندهم دائما dry skin. So usually dry skin, this cause itching, generalized itching. فجماعة الدايابيتس usually suffer from itching due to dry skin, not because of elevated blood sugar or uncontrolled diabetes. The itching is because of the dryness. Also, can be due to other factors. For example, there is secondary infection, candidal infection, okay? And the infection, this pruritus could be localized or generalized according to the site or extension of the dryness or localized cause of infection. Number 4, ulcers, usually common seen in leg and feet, can be due to ischemia, infection, atherosclerosis, microangiopathy, neuropathy. Gangrene usually affect the lower limbs due to atherosclerosis of the blood vessels, which lead to ischemia and gangrene. Skin infection, most commonly staph infection, is common in diabetic patients, like boils, carbuncles. Other types of infection, like Pseudomonas infection, also can occur. Candidal infection, other infection as erythrasma, fungal infection as dermatophytosis, tinea pedis, others. Granuloma annulare. This represents an annular lesion with an elevated border of small papules. نسميها beaded border, beaded, مثل المسبحة, or the border of small papules, usually on the back, hands, and sometimes on the dorsal of the foot can be seen. Usually are multiple, can present as single, but usually are multiple and may clear up spontaneously after a few months or years. Many modalities for treatment, as regional corticosteroids, and even a traumatic process. A traumatic process can heal the problem. Like مرات نسوي skin biopsy for the lesion نشوف there is clearance of the lesion. A condition which is known as reverse Koebner. تعرفون Koebner phenomena؟ سامعين Koebner؟ سامعين شيء اسمه Koebner phenomena؟
نعم دكتورة.
اوكي. هنا عندنا reverse Koebner. reverse Koebner يعني هنا Koebner انه there is a trauma causing a lesion at the site of trauma. Example مثلا psoriasis, incision or a surgical incision or trauma can cause psoriasis and a patient with a psoriasis. Here we have reverse Koebner. We do trauma at site of the trauma, there is disappearance of the lesion. Condition known as reverse Koebner. Other cutaneous manifestations, we have necrobiosis lipodecay. اللي مداومين clinical شايفين الصور عليها واحنا متكلمين عليها. Well-defined waxy plaques with red, brown margin, atrophic, smooth, sometimes yellowish center. We can see telangiectasia on the surface. Usually, they are bilateral, symmetrical, common size here, shin and dorsal aspect of the feet. 35% of cases, 35% of cases have an ulcer, present with ulcer. Patients with necrobiosis lipodecay may be diabetic patients, or just they have an abnormal glucose tolerance test. 16% of patients with necrobius lipidica have diabetes, but only 1 to 3% of diabetic have necrobius lipidica. إذن إحنا من عندنا مشكلة النيكروبايس lipidica نشوف أنه large number منهم have diabetes. بس لو نجي على النيكروبايس lipidica in diabetic patients, it's not a very common manifestation. It's just 1 to 3% just of cases of diabetic patients can present with this problem. Treatment, usually we can use aspirin, dipyridamole, intralesional corticosteroids can use with caution because we have an atrophy. Glucose control will not clear the lesion. Usually it is difficult to treat, yani. It's not easy because we already have an atrophy in the skin.
دكتورة شنو اللي يكون الألسر بعدين؟
نعم.
يعني إذا واحد عنده نيكروبايوسيس لايبويديكا احنا قلنا ممكن يصير progression to ulcer. يعني الاسبرين والدايبيريدامول راح يمنع هذا البروجريشن؟
To prevent, yes. To increase the blood supply. Because already you know diabetes.
يعني هي vasculopathy تقريبا يعني اسكيميا نتيجة اسكيميا هي صارت؟
لا مو نتيجة اسكيميا لا. عندنا necrosis deposition of lipids in the skin. Many factors. ما تقدر تقول انه ممكن واحدة من الثيوريز انه ممكن يكون الرول اسكيميا. But here many factors. يصير atrophy بالسكين أنا عندي. أكفر lesion within the skin يصير atrophy and the deposition of lipid in that side. Okay. إضافة إلى عندي الاحتمال إنه أكو عندي atherosclerotic effect. Okay. In the lesion. فاسبرين هو واحدة من الثيوريز هي هاي فإن الاسبرين to prevent as you said or to increase the blood supply to the lesion.
تمام دكتورة. والدايبيريدامول هم نفس
the same effect. Yes, the same purpose. Okay.
شكرا دكتورة.
تذكرون which type of xanthoma قلنا associated with diabetes? Eruptive xanthomas. Eruptive xanthoma. Other manifestation we have keratinosis, acanthosis nigricans. Acanthosis nigricans, which means increased velvety of the skin. تضخم الجلد, increased velvety of the skin, present with hyperpigmented thickening on the neck, axilla, okay, brown lesions. Other like erythrocytes like erythema, periangual telangiectasia, pigmented purpura also can be seen in diabetes patients. Endocrine disorders, association of endocrine disorders with skin. Example, we have hyperthyroidism. Hyperthyroidism نقسمها changes in the skin, hair, nails. The skin هنا راح نشوف moist, warm, soft skin. We have localized or generalized hypertrichosis. We have palmar erythema, flushing of the face, head, neck, peritibial myxedema, which is thyroid dermopathy, pruritus, and even urticaria. Hair, we have soft hair, fine, silky, striated hairs. We have a condition known as diffuse reversible alopecia telogen effluvium, chronic telogen effluvium. Nail growth usually have a faster rate of growth. We have plumber nails and thyroid acropathy. We have generalized or localized hyperpigmentation. Association also varies with vitiligo as an autoimmune disorders. هذا الثايرويد dermopathy, الثايرويد acropathy, plumber nails تشوفون انه الnail changes. الهايبوثايرودism عكس الهايبرثايرودism تقريبا. We have here dry skin, cold, thick skin, buffy edema of the face, hand, and eyelid, dryness, xerosis. هناك عندنا most dry, xerosis, dryness, pruritus, purpura and ecchymosis, xanthomatosis, generalized myxedema. Alopecia also we have with coarse, sparse hair with loss of the lateral third of the eyebrow. اللي هي madirosis. Madirosis means loss of the lateral 1/3 of the eyebrows. Okay, نسميها madirosis. We have brittle nails, slow nail growth, delayed wound healing, palmoplantar keratoderma. Acromegaly, which is thickening of the skin with increased sweating. Here, skin have tendency for pigmentation. We call it Addisonian skin hyperpigmentation. Hirsutism, increased sebum production. Cushing syndrome, skin changes associated with Cushing syndrome. We have moon face, buffalo hump, striae, telangiectasia, hirsutism, androgenetic alopecia, acneiform rash, and also Addisonian skin hyperpigmentation. Striae deficiency, it's a very common, occur in most adult female as present as visible linear scar form in area of dermal damage produced by stretching, overstretching causing damage, okay, and within the connective tissue of the derms, present as striae. Usually start as red striae, okay. Within time, it will become white striae. There's a lot of causes. Usually in early puberty, this is a physiological نتيجة to the growth of the body with this distension of the skin, pregnancy, sudden change in weights, diet وضعف، سمن وضعف كلها تأثر. Corticosteroids, topical or systemic use of steroids can cause striae, side effects of steroids. Cushing syndrome, genetic predisposition, susceptibility, and heavy weight lifting. Usually present early as depressed line with thin red cyanotic color, which later become white, shiny, and smooth. Affect the area, most common area, lumbosacral area in boys, breast, buttocks in girls. However, can affect the axilla, shoulder, and inguinal area. Usually, striae is a reason of cosmetic importance only. There is no, it's asymptomatic, and sometimes not. They may ulcerate. Rarely, طبعا. Histologically, we have breakage or retraction in the elastic fibers with thinning and decrease in collagen fibers. Treatment, there is many modalities of treatment. ممكن نستخدم الليزر، أكو topicals, creams، ممكن emollients, laser, but no one have proved to be highly beneficial. خلصنا endocrine disorders. common endocrine disorder associated with the skin. يعني هسه نبدي بالnutritional problem. Example, a nutritional problem we have a zinc deficiency. Zinc deficiency, either we have acrodermatitis enteropathica, which is a primary zinc deficiency, or it could be secondary causes. We'll talk about the primary zinc deficiency. It's an autosomal recessive disorder, start in infancy or in early childhood following weaning. Usually presented with growth retardation, diarrhea, and hair loss, with vesiculobullous lesion and crustation. Usually these lesions around the body orifice, يعني perioral, in the genital area. perioral نسميها لهذا نسميها acrodermatitis in the hand also. Preorificial erosion that spread to the vermilion border, affect the mouth, the nose, around the eyes, and the genitalia, presented as a dermatitis-like picture or psoriasis-like picture. Also common involvement للhand and feet نسميها acrodermatitis. Okay, usually لهاي الكونديشن للبيبيز بس ان ننطي zinc يصير dramatic response within 24 hours. بس نعدل zinc level. Okay. Other causes of acquired zinc deficiencies are secondary. Zinc depletion syndrome, usually patient on parenteral diet, feeding, deficient intake, malabsorption disorders, zinc deficiency in breastfed infants and premature children, alcoholic liver or pancreatic disease, intestinal bypass operation, cancer, chemotherapy, HIV infection. الdiagnosis قلنا clinically, patient presented with erosion, okay, multiple erosions on the hands and around the mouth, around the genitalia, then a dermatitis-like picture or a psoriasis-like picture, okay. من نقيس الزنك level نشوف less than 15 nanogram per ml. This is prove the diagnosis. Treatment usually using oral zinc sulfate in a dose of 10 milligram per kg, or an adult 20 milligram 2 to 3 times per day. There is usually a dramatic response. Okay. Pellagra. احنا كل شيء لازم ناخذ في نبذه خفيفه. ادري المحاضره دسمه بس هي يعني شابتر كامل بكتاب ترى. يعني نحاول ناخذ مقتطفات حتى نلحق. البلاغرا
اكروديرماتيتس ديرموباثيكا
اكروديرماتيتس يس
تصير بالسكندري زنك ديفيشنسي لو بس بالبرايمري؟
لا البرايمري هو الاوتوسومال فورم اللي هي الاوتوسومال ريسيسيف. زين البرايمري الزنك ديفيشنسي سكندري. انت سؤالك شنو كان؟ السكندري وين يصير؟
لا هو بالبرايمري وبالسكندري اثنيناتهم راح يصير عندهم اكروديرماتيتس انتروباثيكا.
The same picture, yes the same picture.
تمام.
بس السيفيريتي والديستريبيوشن والاراوند ذا ماوث جنتال ليجن يعني كلينيكال برزنتيشن لا بالاكروديرماتيتس انتروباثيكا تكون واضحه. مرات الزنك ديفيشنسي انه مجرد يجي as a dermatitis like picture without an erosion, زين or perioral or peridental lesions not responding to topical treatment. يعني احنا مرات يجينا عوانا dermatitis نعطي treatment of dermatitis وماكو اي ريسبونس. ليش؟ لانه اكو زنك ديبليشن. متى ما عدلت الزنك زين راح يصير الريسبونس دراماتيك ريسبونس. ما اعرف واضح عندك الفكره؟
واضح دكتور.
طيب بس انا الكونديشن اوف اكروديرماتيتس انتروباثيكا تعتبر البرايمري زنك ديفيشنسي. الكوز مالتها انه there is autosomal recessive disorder. there's عندهم mal absorption للزنك. ما يصير عندهم absorption للزنك بس يصير عندهم depletion. بينما other cause لا انه اكو اصلا مصدر الزنك قليل. اكو يعني مصدر الزنك اللي ياخذه صار عنده قليل فلهذا انه يطلع عندهم المانيفستيشنز اوف zinc deficiency. البلاغرا اللي هو النياسين deficiency due to inadequate dietary supply of niacin or its precursors because tryptophan أو tryptophan اللي هي الprecursors مال النياسين presented with diarrhea, dermatitis with dementia. Clinically have as a burn-like effect, chronic sunburn. هاي البيكتشر مالها. Red edematous superficial scales on area exposed to sunlight present as trauma, pressure, friction also can involve can help with the involvement of the disease. Distribution مالتها usually on the face, neck, wrist, dorsal aspect of the hand, يعني in sun exposed area. Okay. Presented as dusky brown, red discoloration with exacerbation following exposure to sunlight. Usually they are bilateral, symmetrical. هذا الساين نسميه castle necklace sign اللي هو ال eruption around the neck. فعندي hyperpigmentation with thickening. With niacin, use of nicotinic acids or nicotinamides orally. There is usually also dramatic response within 48 hours. السكيرفي اللي هي فيتامين سي deficiency, skin changes, follicular hyperkeratosis, corkscrew hair. تشوفون الشعرة زين صايرة مثل الأسنان المنشار متعروجة زين نسميها corkscrew hairs. Perifollicular hemorrhage around the hair follicle. أكو عندنا perifollicular hemorrhage. Gingival hypertrophy and erosive bleeding gums. High features of vitamin C deficiency. Liver diseases. In general, we have generalized pruritus, which may be related to bilirubin, spider angiomas, caput medosa, urticaria, palmar erythema, loss of male sexual hair pattern, normal distribution, gynectomasia, diffuse pigmentation, maculopapular rash, xanthomatosis. We have nail changes. We have teres nail, clubbing, colonychia, paronychia, porphyria cutanea tarda, lichen planus, which may be related to hepatitis C virus. Hepatitis C. Caput medosa اللي هو dilatation and tortuosity of the blood vessels. Renal diseases, picture which may be related to uremia. We have urea frosting, dry scaly skin, generalized intense itching, pruritus, pallor due to reduced erythropoiesis and increased hemolysis, earthy look of the skin, muddy brown or gray skin discoloration, نسميها earthy skin, half and half nails, purpura, calcification, common problem, present with calcification, acquired perforating dermatosis of end-stage renal disease, نسميها acquired perforating dermatosis. They present with implicated papules or nodules with center hyperkeratotic core seen in end-stage renal diseases. Renal failure. هذا perforating dermatosis. قلنا multiple papules with center keratotic centers or plugs. GIT problem, most common changes associated with inflammatory bowel disease, ulcerative colitis, and Crohn's disease. The most common changes اللي هو erythema nodosum, erythema multiforme, pyoderma gangrenosum, recurrent ophthalmic stomatitis, epidermolysis bullosa, aquosita, cutaneous vasculitis, glossitis, clubbing of the nail, urticaria, and angioedema. Malabsorption problem can cause pallor, edema, dry skin, skin pigmentation, oral ulcer, eczema-like or psoriasis-like picture, ecchymosis, brittle hair and nails due to malabsorption. نجي على bioderma gangrenosum. Bioderma gangrenosum is a destructive, necrotizing, non-infective ulcer of the skin, usually present as furnicle-like or nodule, okay, or a pustule, with develop a bullae that become necrotic, ulcerative, and then develop an ulcer with a violaceous, undermined edge and purulent base. Okay, usually ulcer heals later with a trophic scar. It's painful, seen most commonly on the legs. المميز به undermined violaceous border. The common problems or causative agents مالتها inflammatory bowel disease, Crohn and ulcerative colitis, rheumatoid arthritis, liver diseases, some hematological malignancies like leukemia, multiple myeloma, HIV infection, and 30%, 10 to 30% have an idiopathic origin. Treatment, يعني أكثر dramatic response للcorticosteroids. treatment we have topical, systemic. Topical احنا نحاول corticosteroids with topical antibiotics, antiseptic for cleaning the ulcer base, wet compressing as a drying agent, high topical. Systemic we give corticosteroids. Alternative to corticosteroids we have dapsone, cyclosporine, thalidomide, according to the underlying cause. طبعا نختار other treatment. إذا كو hematological malignancies أو Crohn's أو كذا ممكن يعني نختار التريتمنت اللي نريده. بس المين goal of treatment هي corticosteroids. Behçet disease. Behçet disease is a disease with multiple etiological factors. Seen more common in male and more than females. Have يعني من تقول Behçet disease يجي ببالكم recurrent oral or genital ulcer. Major characteristics هي طبعا أنت major criteria و major criteria. Recurrent oral and genital ulcer with eye problem and skin problem. The eye problem present as anterior or posterior uveitis, and most commonly retinal iridocyclitis. We have retinal vascular changes, optic atrophy. It's a serious complication because it can lead eye lesions and uveitis can lead to blindness. فإحنا أي patient يجي with recurrent oral or genital ulcer, we have to search for Behçet disease, have and search for if there is any eye problem. يعني sent for ophthalmologist for ophthalmological examination. Skin changes may have papules, vesicles, pustules, bioderma-like pictures, folliculitis-like picture, erythema nodosum-like lesion, acneiform rash. أكبر شيء اسمه pathergy test عادة يكون positive in Behçet disease. The minor criteria, there is GIT involvement as intestinal ulcer, cardiovascular involvement, CNS involvement, and then here systemic diseases, thrombophlebitis, erythema orchitis, arthritis, renal involvement, proteinuria, hematuria. احنا عادة بالdermatology if there is an oral ulcer with two of the major criteria يعني اكو eye lesion or skin lesion with recurrent oral or genital lesion with recurrent oral ulcer نقول عليه Behçet disease. قلنا diagnosis clinical, pathergy test, and we can send for tissue typing human leukocyte antigen B50 and B51 and B5 يكون positive markers. These are markers for بهجت disease. الباثولوجي تيست شنو؟ الباثولوجي تيست هو needle usually gauge 22 needle ننطيه intraepidermal to the skin with slight puncturing نسوي بالskin. then اوكي ويعني نسوي puncture خفيف بالسكن intraepidermal بزاوية أقل من 45 read it within 24 hours نشوف أكو reaction or not. إذا أكو reaction سواء papular reaction vesicular reaction ممكن يكون هذا positive for pathology test. مرات بس erythema usually appear within 24 hours after induction of the puncture.
يعني كوبنر
ما يطلع لي reaction شلون البريك تيست. بس أنا لا إنه بس أسوي فد تروما أسوي تروما خفيفة puncturing usually with a needle gauge 22 زاوية أقل من 45 intradermal ما أنزل أكثر ولا أكون superficial. يطلع لي فد reaction ممكن يكون flare ممكن يكون papular reaction. زين هو مو كوبنر أنت ما تطلع الليجن بس أكو فد body reaction لهذا الليجن يعني أكو فد reading. إذا ماكو شيء يعتبر pathology test negative. إذا أكو فد reaction papular vesicular يعني هو كوبنر من أشوف that the same مثلا psoriasis أشوف psoriasis أسميه كوبنر lichen planus أشوف lichen planus vitiligo أشوف vitiligo. نعم أنت تشوف the papular region it's not a reflect of that disease. yeah. okay التريتمنت differential diagnosis طبعا herpetic stomatitis aphthous ulcer oral pemphigus Steven Johnson oral CA treatment mouthwash eye treatment طبعا هاي systemic immunosuppressive drugs إذا كان أكو eye involvement. بالنسبة للماوث واش نعطي oral xylokines نعطي oral triamcinolone paste or gargle tetracycline solution دائما نقول أسوي غرغرة for enhanced healing. أكو other topicals مثل using of honey using other remedies تساعد for healing of the ulcer. systemic therapy هنا عندنا dapsone have a dramatic role يعني role يعني in the line of treatment the first line is using of dapsone. Other immunosuppressive drugs like MTX, methotrexate, colchicine also corticosteroids etc. other immunosuppressive agents. من هنا أنا خلصنا المحاضرة مال اليوم. نسوي في الجنرال ريفيو إحنا شنو أخذنا. قلنا الزانثوما والزانثلزما زين وعرفنا الكلينيكال تايبس مالتها. حكينا على السيستميك ديزيز أخذنا على example of endocrine disease diabetes with skin changes in diabetes hypothyroidism hyperthyroidism endocrine problems other like الأكروميجالي والكوشنج syndrome skin manifestation associated with. بالنسبة للنيوتريشنال قلنا zinc deficiency وقلنا niacin deficiency. other GIT problems قلنا مثل ulcerative colitis or inflammatory bowel disease ulcerative colitis with Crohn's in general for both disease ما فصلناهم حتى لا تدوخون. in general أخذنا ال common findings اللي نقدر نشوفها both of them. وقلنا ال symptoms associated with malabsorption in general skin associated with any malabsorption disorders. وتكلمنا عن liver diseases skin changes in liver diseases in general بدون تفصيل والrenal diseases. وعرفنا شنو البايوديرما gangrenosa والبهجت disease. أحد عنده سؤال؟
دكتورة عفوا السؤال بس مو بالمحاضرة هاي.
اي تفضل.
دكتورة شلون اميز كلينيكلي بين الهربيتيك ستوماتايتس والهربنجاينا؟ نفس الشكل قاعد يصير.
هو نفس الليجن كلينيكالي زين بس history examination family history recurrent past medical history كلها يعني تعطيك clue تعطيك clues.
يعني هو ماكو فد شيء يميز بيناتهم، يعني انا حتى الكتاب ما قاعد اباع فد شيء نفس الشكل ونفس الكرايتيريا يعني بس اظن يعني بالهربس ممكن الحين يتعالج، هذاك ممكن 10 ايام يختفي بعد ما يرجع للشخص.
سيلف ليميتنج قصدك؟
بالنسبه للهربنجاينا لان كوازاتي بينما الهربس ممكن يكون ريكارنت بالتالي ممكن يفيد
لك الهيستوري. انت لما يجيك بيشنت with herpes راح يكون عنده recurrent يعني recurrent history of herpes. ذاك لا although sudden attack جاء first time فهنا history examination previous past medical history هم تساعد. السايت همنا هو both same site اثنيناتهم في the same site ممكن. والتريت يعني the clinical presentation هي the same ترى both of them.
تمام واضح.
الهيستوري هي تساعدنا الهيستوري والاكزامينيشن.
واضح.
أحد سؤاله؟ اوكي هي أخذوا راحتكم إن شاء الله. خلصتوا آخر محاضرة بالدرماتولوجي.